Hospital. That moon of anniversary is here with us. We are here to celebrate. We are celebrating success. We are celebrating joy. We are celebrating life through our medical input in the Multi-System Hospital.
To round off the 6th anniversary of ABUAD Multi-System Hospital, a lecture was organized titled Achieving Universal Health Coverage Through Mental Health Service Creation. The lecture's aim was to draw attention to the causes of mental health, especially in present-day Nigeria, challenges of patients, responsibilities of medical practitioners, and what should be the intervention of the government and institutions.
The World Economic Forum estimated that more than about 16 trillion could be economic cost of not treating existing mental health condition. So these are very, very strong points that make a case for integration of mental health across services. But despite the staggering evidence that shows that this is the way to go, there are still cases against it, that there's not enough resources. Lack of resources. Economic recession, under 5 mortality, diarrhea, malaria, a lot of money goes into that. HIV, that infectious disease, they kill faster, they kill. And so this one does not. Within all this, if you look closer, there are mental health contributors to those indices. And it has shown that actually, low and middle income countries, sub-Saharan Africa, you will have people dying more from non-communicable diseases than communicable diseases. When we have a commitment to integrated approach, then mental health will be part of the whole system. Mental health is in the 9th component, is the 9th component of the essential care package in primary health care. And basic health care provision fund is for primary health care. And so mental health should come into this.
Dr. Tunde Ojo, a consultant psychiatrist, identifies the evolution of mental health program.
Mental health was like a neglected child, where alcohol is, where hypertension is, where stroke is, diabetes is. That's where a lot of money goes into. And so the minister then seeing the rising burden and that Nigeria cannot just afford to be left out in the direction the world is going. And so the National Mental Health Program was created, moving it from being a desk to a division on its own. So, and that was when I came on as the national coordinator for the National Mental Health Program. And within that space of 2 years, the country had been able to pass what is known as the National Mental Health Act of 2021. Before 2022, the law that was governing the administration of mental health in Nigeria was a very archaic law, a pre-colonial law that is called the Lunacy Act. And even from the name, you can see how archaic and very derogatory that was. But by the passage of that law, the National Mental Health Act, it protects the right of people that have mental health conditions, make it mandatory for increased coverage of mental health services for all the people that need it, and also created a Department of Mental Health Services to be able to govern and plan for mental health services delivery in Nigeria.
Dr. Mobolaji Dada, a consultant psychiatrist with Ekiti State Teaching Hospital, draws attention to the importance of adequate training of medical health practitioners.
Currently in Ekiti, we have about 10 psychiatrists as a whole, including the private and the public institutions. That means that if you assign a psychiatrist to 3 local governments or 3 LCDs, you probably still have some LCDs or local governments without a psychiatrist. But like the keynote speaker said earlier, the goal is not to have psychiatrists at these levels. But what is to be done is training and retraining of others. Train medical officers, train nurses, train community health extension workers at the primary care level so that they can at least identify some basic mental illnesses and give appropriate medications to these clients or patients. Like they say in Yoruba, "Owo ni keke inyerere." Lack of funding is a major obstacle. There are too many programs competing for the limited resources available.
As for Dr. Adedotun Esan, a public health professional and a mental health advocate, strategies should be developed to address stigmatization of mental health patients.
So some of the strategies are one, which we cannot overemphasize, is education and awareness. If people know, they are able to do better. If we don't know, we can't do better. So individually, it is our responsibility to know. So we must promote public education. Thanks for this platform. We have this platform to do that. We have to increase awareness to understand mental health issues. Also, these campaigns can challenge stereotypes. It can provide accurate information. So we have a lot of information flying around the internet. Many of us do not even know which is true and which is not true. But if we have a targeted space for proper information and you are able to access this, you know what the right information is.
Reverend Joseph Bamidele, the first aider of mental health service, is concerned about the unfriendly behavior of health practitioners towards patients.
We must be approachable because my experience has taught me that even some of our health workers, if not for the intervention of my presence, sometimes the way they treat or they respond to those who have come for treatment, that is not quite encouraging.
He advises parents to be watchful of their children and their peer group so as to detect early signals of negative influences.
We must endeavor to sensitize parents about the dangers in, hard drugs, intakes of hard drugs. Because in that time, truth be told, we are having a bunch of parents who are not responsible. Truth be told, parental irresponsibility is getting increased on a daily basis.
A highlight of the program is the confession of a young man about his struggles through addiction and rehabilitation. His bold confession is appreciated by the Vice Chancellor and everyone.
Since the establishment of Afe University at Ekiti, we have remained resolute, focused, committed to ensuring that our immediate community, country, and the entire world is better, and we have not faltered. This has guided our steps and has ensured our fidelity to ennobling ideas, one of which is why we are gathered here today: mental health.
Earlier, the Chief Medical Director of ABUAD Multi-System Hospital, Dr. Kolawole Ogundipe, spoke of the objective of the establishment of the ABUAD Multi-System Hospital to complement the university, serve as a training center, and provide a first-class health care.
The hospital is fast gaining its place as a leading center in kidney health with the inauguration of the state-of-the-art dialysis centers. The center was established in conjunction with world-renowned experts, and we have 16 modern dialysis machines installed in the first state, which have been working very well. Starting with just about 10 dialysis when we started, the facility currently run over 400 dialysis every month. We've moved further to be able to provide renal transplant procedures, and as of today, 14 patients have benefited from our kidney transplant program. In other areas, we have continued to be that center that has the capacity to provide cutting-edge medical and surgical services that are available only in best hospitals around the globe, including things like the fertility services, brain surgeries, joint replacement surgeries, oncology procedures, eye surgeries, back surgery procedures, among others. In terms of medical education, the hospital has also been joining hand with the university in providing the medical services, in providing training for our undergraduate medical and allied students. There's no guessing that the University Medical School, which started just about 12 years ago, has graduated 6 sets of medical students, and they have access to state-of-the-art equipment that can only be found around here. The clinical skill laboratory, one of its beds, was also put together in the year of 2021 to complement the service.
The 6th anniversary of the Multi-System Hospital winds up with a song of appreciation to all. Samson Olagunju reporting for Puff TV.
People of the Fountain.